Nurses are angry and nurses are frustrated. Most of all, they're scared for our community.
Our staffing in Maitland Hospital is atrocious. Our nursing staff have used every means possible through our award system to try and highlight the severe unsafe practices and unsafe staffing within this hospital.
There might be 20 plus patients in a waiting room with one waiting room nurse. It's really unsafe, and I'm concerned that somebody's going to die.
Short staffing is like drunk driving, and it's true, and a mistake will be made, and once those mistakes are made, they can't be taken back. It is a foreseeable risk. The government knows that, and they've got to provide you with safe staffing.
We haven't had an increase in staffing in the ED for probably over 8 to 10 years, and yet our increases have come at 9.5%.
We have 2 resuscitation beds in our department, and that can have 2 resuscitation patients in it at a time, and often that can be staffed by one nurse. One nurse cannot look after 2 resus patients. It's not safe.
We also have maternity units that are actually being directed to receive surgical patients when they're not registered to look after them.
It's not good enough for our community. Our community deserves to be able to come into our hospital and know that they are going to have the staffing that is going to be able to help them through our health system safely.
Everyone from a management and district level are aware of this, and their hands are tied. They say they have no resources, so it's a budget thing. We don't believe that budget is an excuse for patient care. We need to be the patient's advocate, and we need to keep fighting.
We need a complete overhaul of all of our staffing in our ED. We need to look at all of our shift times. Night shift in particular is really, really unsafe, but it's our whole 24-hour period, and we need an increase to our staffing.
Enough is enough. Brad Hazard, you need to come to Maitland. You need to fix this staffing. It's not safe.